Hi, I'm Jairus Rossi. I'm a research professor in Ag Econ at University of Kentucky, and what I'm going to be talking about is how community-supported agriculture programs, if you're working through a workplace program like we have experience at with our university, what kind of benefits that has for farms, for the workplaces themselves, and for the employees that participate in a CSA subscription. So this work, a lot of what I'm going to talk about is based on original research that we've done in the university through our voucher program. So our voucher program started as a pilot in 2015, where we were just looking at first-time shareholders, people that have never had experience, and we were trying to understand what kind of impact that participation may have on behaviors, consumer behaviors related to food, and sort of their own perceptions of the program. So we're looking to expand that, and in part one of this talk, Tim Woods speaks about kind of development of that program over time. But I'm just going to talk about the benefits. And so when we think about benefits, we're thinking about it from the perspective first of the workplace, because what we've done is we started at UK, and we've kind of moved out into other employer organizations around the state, and even we've been working with employers or organizations around the country to do a similar kind of thing. But you have to make a kind of pitch to that workplace about why you might consider having a subscription to a vegetable box, and why that workplace might financially support a voucher or a cost offset so that it is more accessible to their employees. So from the perspective of the workplace, what are the kinds of things you might say? Okay, so or what kind of workplaces might be looking to adopt something like this? Well, there are many benefits, and some we focused on employers that were had self-funded their own health insurance plans. So part of what we have looked at is how do CSA programs impact healthcare costs. And I'll talk about what the research there looks like, but that's something that some employers are concerned about. And a lot of employers, especially universities, have existing wellness programs, and so something like a CSA where you get a box of vegetables every week can fit in really nicely with other things that are, other programs that are being offered by health and wellness organizations within that employer. Employers, when we first started doing this project, we were looking at the rapid increase in healthcare costs across the U.S., and sort of that we were seeing a rising trend in terms of just the cost to an individual, to an employer, to anyone who's dealing with healthcare, of just having people maintain their own health. And so we have some data looking just at University of Kentucky employees who were involved in the health and wellness program, and over time from 2014 to 2018 we saw almost a doubling in terms of healthcare costs per person, and these are folks that are actively involved in health and wellness programming too. So that was kind of where we started, and our idea here was that, okay, CSA is vegetable based. You give people vegetables every week. They eat the vegetables. Vegetables are good for you. So maybe there is a measurable impact on health, potential like medical claims. So we were actually able to get access to medical claims from people that were involved in CSA at UK and people who were not involved in CSA. And just from the analysis that we did, we found some preliminary evidence that people that are subscribing to CSA compared to a control group of people that are not, actually have a lower rate of change of their diet-related medical expenses. So this research project is complicated and needs more validation amongst other employee groups. But it does have some indication that if a workplace does fund CSA, they may be saving some money in healthcare costs for their employees. Now, that points to kind of the broader shareholder benefits. So the shareholders are what we call people that subscribe to a CSA. And so employees that are using CSA, we did pre and post surveys of, before this CSA program, they would answer some questions about behaviors related to eating vegetables, to shopping, to food preparation. And they did then take the same survey afterwards. And so we collected data over the course of 4 years, starting with a pilot in 2015. Our kind of thesis or hypothesis was that, okay, CSA, eating more vegetable, may improve wellness outcomes. It also may educate people about nutrition, about local agriculture, and about food. Where does your food come from? We also felt that CSA can actually be a convenient model. So you pick your vegetables up at your workplace. So for people that are having, it could be at the workplace, it could be at another place near your house. For people that have limited time to shop, this may actually be an easy way to get fresh produce. It improves access to higher quality food because it's fresher. It was picked very recently, and compared to the quality of what you might get from something at a grocery store that was grown in California, shipped across the country, ripened in a warehouse, the qualitative difference is significant. Anyway, anyone who's involved in a CSA can share what they're getting, all these fresh vegetables, with their household, their neighbors, their friends, their families. So it's just increasing access to fresh food. And so returning back to this kind of these employer surveys that we did before and after, we find that, especially with people that have never done CSA before, they have a lot of behavior changes that are statistically significant, including eating more vegetables, which is what we'd hope to see, but we were able to measure that. Increased salad consumption of green salads, decreased consumption of processed snack foods and meals, increased knowledge about how to prepare foods, fresh foods. And even we saw some things, eating out at restaurants less, eating at home more, and having a different idea about shopping. So people that have been involved in CSA they seem to be more willing to look for local food in other market venues. They may be more receptive to organic foods and things like that. So beyond just food consumption, there's a broader set of behaviors that this affects, and that has implications for their households and for, it creates a culture of health within that workplace and beyond. So there's also a number of perception changes. It's not just behaviors, but people that are involved in CSA tend to report things like they feel better about their digestive health, or they have more energy, they have a more positive mood. Just whether or not there's a measurable biological change in people over the course of the 6 months that is a CSA subscription, it seems to be a psychological impact on how they feel they are feeling. So in short, we see CSA is really promoting wellness in certain behaviors, and also an interest in local food. So, and we've worked with some researchers in public health, and they've had some preliminary evidence that CSA participants have a change in blood pressure, in A1C. So those are some metrics that wellness organizations really care about and are important to, again, if we can get more people doing research on things like that, it would be really good to see a more comprehensive analysis of that. And then, so we've had workplace impacts, shareholder impacts, and then finally, this has an impact on farmers. So as part of this program, we've been working with a farmer-led organization called the Kentucky Farm Share Coalition, and they've measured the economic impact over time of this voucher program that started in UK and expanded to other regional employers. And so between 2016 and 2021, the program has had over $2 million worth of impact. And we see that the impact increasing year by year. And so, yeah, it's creating new markets for farmers, new opportunities for farmers to sell fresh vegetables to local consumers, because these consumers are now learning about CSA and what it is. It's kind of a confusing model. But once you start doing that, once you start learning about local agriculture, then you may be more willing, like we found in the surveys, to go find local food at your grocery store, or go to a specialty grocery store, or even have a direct relationship with a farmer that you're just buying regularly at a farmer's market or at their farm itself. So there are economic impacts that we haven't fully measured, but are happening. So thank you.